volunteer at Mercy, is that right?
Yeah, so another thing we do for, in terms of volunteering for NAMI Dubuque is we try to once a week go to the psychiatric unit, at Mercy Hospital. We just sit at a table inside the unit and we meet with anyone that is a patient there that would like to talk to us. We provide, resources and referrals for them, and both Diane Bucko, the president of NAMI Dubuque, and I are people with lived experience, so we relate to them on a peer-to-peer level.
Can you tell me a little bit about, what motivates you to volunteer and why you do what you do?
Yeah, so I volunteer. Most of my volunteer work is done within the universe of mental health. So again, education, advocacy, and support. My passion for that comes from my own lived experience. I was diagnosed in 2012, and during my process of recovery, it became clear that support and education were critical for me in my own recovery, and that not enough people going through some of the things I went through were getting or had access to the support they really needed.
So what do you hope people, comes from, the work that you do? What would you like to, see happen? Or
I would like to see outreach efforts for mental health in general, not just NAMI, but really broaden in terms of geography and scope. I'd like to see us reach more people, and I'd like us to continue to work with providers and agencies and legislators on ensuring that there's funding for mental health services, that they're accessible, that they're in the right places at the right time for the right people, and I would like ultimately to do whatever we can to reduce the stigma associated with mental illness.
So what do you think are ways people can help reduce stigma?
Well, the first step, right, is just acknowledging that mental illness is an illness. It's not something that people control. It's not something that comes from people doing the wrong things. The second piece is just feeling comfortable and being open to having conversations about what mental health conditions look like, what support looks like, and really just as a community to lift people with mental health conditions up, just like you might with any physical disease or condition. I think I see so many times individuals with lived experience will question to answer, right, because every situation is a little bit different. But it starts with, one, accepting it for yourself, and being comfortable in advocating for yourself, and two, just being persistent and patient and hoping that the seeds of resources and education and awareness are planted and they're cultivated.
Well, is there anything else you wanted to add,
or well, we're always looking for volunteers. You don't have to have lived experience necessarily. Family members of people, friends of people, support breeds support. So it's really just, NAMI's been around for many years, and most days, I feel like we're kind of a continual grassroots effort, right, to get out there and educate, right, because as soon as you educate a group, they'll move on in their own recovery, and there's a new group behind them. So we just have to be really, really persistent and passionate about what we do.
What is doing all this volunteer work and professional work in the mental health arena taught you personally?
I think for the most part, it's taught me that my life isn't all about me, right? We're put here to support one another, and care for one another. And when I got sort of over my own ego, not by choice, but by my situation, I just felt empowered, to just kind of spread that recovery story and to give people hope.
Mm.
And that's why I do it.